Is your knee stiff and achy and hurts when you walk and use the stairs? Have you been told that you have knee arthritis? Have you been made to feel that there's nothing you can do, that you have to just live with the pain, stop walking, and wait until you're old enough to get a knee replacement? Well, this video is going to go through evidence-backed ways that can help you manage your knee pain from arthritis, help you modify the way you do things so that you can still get around independently, and delay knee surgery for as long as possible. Hi everybody, in this video we're talking about knee arthritis and what you can do to help manage your pain. Welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips that you have found to be helpful for relieving knee arthritis pain so that we can all benefit in our own personal journey to better health. If you are suffering with knee arthritis, you're not alone. Most people have some degree of knee wear and tear by the time they're 50 years old. Usually, knee pain comes on very slowly, but sometimes it can come on quickly, especially after an injury like a fall or car accident. If you previously had meniscus or ligament damage from sports or falls, your likelihood of getting knee arthritis also increases. What can we do to treat knee arthritis? Here are 11 tips. Number 1, put a microwavable heating pad for 20 minutes on your knee before you do your exercises and at the end of the day. Rest your leg up on some pillows above heart level to encourage the swelling to move. The heat will increase the blood flow to your muscles and joints, improving stiffness, repair and recovery, and whisk away inflammatory cells. If you're finding that your knee is already red and puffy, you can also try using ice for 20 minutes to control the swelling. In general, if your knee feels stiff, use heat. If your knee feels swollen, use ice. Number 2. Some people find that their knee hurts more when there is a change in weather, like a change in barometric pressure, such as before a large rainfall or snowstorm, or when the temperature fluctuates above and below freezing. This is why fall and spring are often times when knee pain seems more severe. A lot of people with arthritis say that hot, dry climates suit them best. If you don't have the luxury of moving, you'll probably want to match your outdoor activities to the weather. Number 3, wear good shoes with arch support and rubber soles all the time. Knee problems often start with poorly aligned feet and walking patterns. Once the cartilage has worn away between the joints, you may feel more pain when you're walking on hard surfaces like sidewalks, concrete floors, and bare feet. If you don't like wearing running shoes inside the house, consider wearing Crocs. Crocs are easy to slip on, lightweight, and have good cushioning. They can also accommodate orthotics nicely because of the lip on the back. Number 4. When you have more advanced knee arthritis, there is moderate to severe thinning of the cartilage. When you lose the joint spacing from worn down cartilage, your knees can feel more unstable. You may feel like your knees click or shift, or like your knees will give out. You might feel scared that your legs won't support your weight. There are a few solutions for this. The first is to invest in a good supportive knee brace. An open wrap knee brace is better than a knee sleeve. The adjustable design accommodates the swelling that comes and goes and increases towards the evening. If you have trouble walking outside your house for more than 10 to 20 minutes because of pain or the fear of falling, then the next step is to get a cane. You can keep it in the car or use it when you go outside and run errands. Remember to hold the cane with the opposite hand to your most painful knee. Finally, if even a few steps cause excruciating pain, then it's time for a rollator walker. The beauty of a rollator is that it folds nicely to fit in your trunk, and it comes with a seat and basket so that you can sit when you need to. Number 5. You may have pain and swelling in the back of the knee that makes it hard and painful to bend your knee. Don't let that stop you. The fluid in the back of your knee is typically a Baker's cyst, which is essentially where fluid collects when your knee is inflamed. Think of bending your knee as a way of squishing the fluid out. Bend it gently, working further and further into the range 10 times in a row, 2 to 3 times a day. Number 6. If your knee pain is so severe and you can't stand, watch our knee exercise video that goes through exercises in a non-weight bearing position. Number 7, remember that you can't actually cure knee arthritis. You can only manage your activity and pain. You'll have to figure out what is too much activity and what is too little. Too much activity like cleaning the whole house, renovating, entertaining, or golfing the entire day may flare up your pain and cause more swelling. Too little activity, like sitting for several hours, can increase the stiffness and weaken your knee. A better strategy is to spread out your activities according to your energy and pain level so that you can change your position and activity every 20 to 30 minutes. For example, after vacuuming or gardening for 20 minutes, sit for 5 to 10 minutes before moving on to another activity. By being moderate with activity and rest, your pain levels can be more low and steady rather than extreme highs and lows. Number 8, the most important exercises that will give you the best long-term relief is to do leg strengthening exercises. The quadriceps muscle is especially important to build because it will prevent your knee from feeling weak and like it will give out from under you. The job of the quadriceps muscle is to strengthen your knee. For example, when you go from sitting to standing and keeping your knee stable when you go downstairs. At the beginning, quad strengthening can be performed by sitting with your legs straight and placing a cushion under your knee. Push the back of your knee down in the cushion and hold it for 5 to 10 seconds. Repeat 10 to 30 times. Bring this exercise to the next level by doing it standing with your back against the wall and putting the cushion behind your knee again. Repeat the same movement where you push the back of your knee into the cushion. Finally, practice mini squats where you focus on contracting your buttocks as you come up. Your knee pain can vary from day to day. On the days when your knees are just too sore to manage squats and stairs, lie down and lift your straight leg up in the air a couple of inches, 10 to 30 times as a way to still exercise without flaring up your pain. On the days that you have more energy and your knees feel good, add in a few mini squats for a challenge. Remember that your muscles will continue to weaken if you don't stimulate them. If you don't practice doing small squats, it won't be long before you are unable to get up from an armless chair, get up from the floor if you've fallen, and use stairs that don't have a handrail. Your mobility and independence will continue to deteriorate little by little. Many people are afraid that doing squats will make their knees wear away faster. But the truth is, when you don't fully bend and straighten your knee every day, you will lose your ability to do it much faster. Astronauts who spend years getting in top physical condition before their mission exercise for 2.5 hours a day on the International Space Station. Why? Because being weightless in space speeds up your body's aging process. Astronauts lose 1% of their bone density per month. It takes a year for a senior to lose 1% of their bone density. Astronauts can lose 20% of their muscle in a matter of 5 to 11 days. Of course, it's not exactly the same thing, but you can see how moving less directly contributes to premature aging and increased fragility. You may have noticed during the COVID pandemic that formerly active seniors became quite thin and frail as the world went into isolation. So again, the two most important exercise concepts to do daily are bend and straighten your knees fully throughout the day and strengthen your knees in a lying position every day and in a standing position 3 to 5 days a week. If you're having trouble getting started, we have some videos on how to motivate yourself to exercise. Number 9, what exercises should you avoid? High impact exercises like running, jumping, soccer, and tennis. Steady, low impact exercises like walking, cycling, and swimming will help you build flexibility and strength without flaring up your pain. Number 10, the biggest predictor of the need for a knee replacement is a high body mass index. Consider losing weight if you weigh more than what is recommended for your height and body frame type. Even a 10-pound weight loss can really make a difference. As you probably know, for permanent weight loss, you need to choose a diet that you can follow for the rest of your life. Avoid crash diets that change your metabolism and make future weight loss even more difficult. Watch some of our weight loss and anti-inflammatory diet videos for some ideas. And finally, number 11, your doctor may recommend cortisone injections. These are steroid injections that are meant to decrease the inflammation and provide temporary pain relief. Treatment results vary. Be aware that frequent, repeated cortisone injections over a long time may weaken the soft tissue and accelerate joint damage. Discuss any concerns with your doctor. Now, if you already have a future knee replacement scheduled, what you might not know is that after surgery, the physiotherapy rehab is intense and crucial for your recovery. And by intense, I mean it can be more painful than you would expect. In the months leading up to your surgery, do your best to stretch your quadriceps frequently and keep it as strong as possible. You'll have a more successful surgical outcome and shorter, less painful rehabilitation afterwards. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.